So this is the clinical situation. You have a couple of patients, 4 patients, right? Um, client A, B, C, and D. And these are their clinical situation. So you have to read it and figure out what each of them are. The 65-year-old client now post left hip replacement, reporting discomfort on the affected legs with ambulation. Right. B, the 35-year-old client with positive blood culture for MRSA with temperature of what? 101.5, white count of 20,000, receiving vancomycin IV. Then client C, a 4-year-old client with phosphonombilious emesis after every meal and palpable abdominal mass, right? And D, a 25-year-old client, type 1 diabetes, brought into the emergency room by the family with confusion, lethargy, abdominal pain, nausea, rapid breathing, and vomiting. 4 patient. It looked like prioritization. You have to figure out what each patient is supposed to be doing. What is their diagnosis? So tell me, 65-year-old client who is now post left hip replacement, reporting discomfort on the affected leg, right, and ambulating. Then B said a 34-year-old client with positive blood culture for MRSA with temperature of 101.5, white count of 20,000, receiving vancomycin IV. And then C is a 4-year-old client, child with a phosphonombilious emesis after every meal and a palpable abdominal mass. While client D as a 25-year-old client, type 1 diabetes, brought into the emergency room by the family with confusion, lethargy, abdominal pain, nausea, rapid breathing, and vomiting. This is what I call buzzword. Okay. If you master these buzzwords, that means key information that will help you make a diagnosis. Then you can figure out what the patient is suffering. And when you figure out what this patient is suffering from, the rest of it is history. You can make anything. So when you go and take your test and they frustrate you with the case study and they don't ask you anything, all they give you is a bunch of words. What I will tell you is try to figure out what the patient have you want to see first. Which of these patients should be seen first, right? Is it client A, client B, client C, and client D? Look at what they have. Then you can figure out. They had hip surgery and discomfort with ambulation. Does that worry you? You have to be sharp. Is this something you expect? You have to be sharp. 35-year-old, positive blood culture for MRSA at a temperature of this and a white count of 20,000 getting vancomycin. Does that disturb you? If it's not, then you got to be sharp. 4-year-old, forceful vomiting, non-bilious emesis with heavy meal, and they have palpable mass. Is this something you concerned about? You have to be sharp. And we have a 25-year-old. He has diabetes, confusion, a bunch of B sharp words, lethargy, abdominal pain, nausea, rapid breathing, and vomiting. Are you concerned about? If you have 1 second taking care of this patient, tell me who you're going to see. The best person to see, you can see who has a bunch of worrisome stuff. D has a bunch of worrisome stuff. So I'm not going to tell you. By using your clinical skills and test taking strategy, you can see if you're counting things are called buzzwords in it. Confusion is not good, right? Lethargy is not good. And he has rapid breathing. It's not good at all. So that's our patient. Which of the following action is a priority for client A? What is the purpose of this question? Is to confuse you, to frustrate you, let you go back and forth, think about it. And that is what, when you're taking the test, that's all they're doing. They're throwing questions at you to like, okay, but stand your ground, hold on to what you know, and don't move, be unmovable. Now we change. We say what? What? Um, which of the following action is a priority for client A? This is client A. So focus on A. A is a 65-year-old guy. He had a hip arthroplasty, right? Replacement. Now he is reporting what? Discomfort when he's walking, ambulation, pain with ambulation, right? Pay attention. So that is his problem. Discomfort when he walks, right? So if you have discomfort when he walks, what are you going to do? Which of the following action is a priority for this client? Are you going to look for assess for venous thromboembolism? Are you going to assess for pulses? Are you going to assess ambulation technique and then obtain CT scan of the leg? Test taking strategy. Keyword to answer the question is, what does the patient have and what do I need to worry about? And what is the case telling you? Patient had a hip arthroplasty. When he walks, he has pain. Therefore, what should be your priority to address that situation? That is all. That is his chief complaint. If you're not addressing the chief complaint, then you're not doing a good job. So what do you want to do? Do you want to look for DVT? Do you want to check his pulses? Do you want to check the way he's walking? That's why he's having pain. Or do you want to check for CT scan and see what is going on? So what do you want to do? Are you going to look for DVT? There's no evidence of DVT. If I want you to look for thromboemboli, I will tell you he has calf pain. Okay, you don't have to walk to get pain when you're looking for DVT. He has calf pain. The calf is a little bit bigger. There's erythema. These are the things I call buzzwords people don't understand. This is it. They ask you a question, they never talk about calf pain. They never talk about dorsiflexion of the foot. They never talk about calf exchange. They say when he walk, he has pain. It can be DVT. Did I tell you about anything that you have to look for pulse? Walking has nothing to do with pain. And with pulses, he has no claudication. And of course, we don't need CT. See how, I mean, he has hip, he has new hip. He has no clue how to walk with it. He has no clue how to walk with his pain. Check the way he's walking and teach him how to walk. Now we got to teach him how to walk. You expect him to have pain when he walk because he just had surgery. And you teach him how to walk, how to take steps so that he will not fall. So that's your key. Now, which action by the nurse is a priority for client B? Same strategy. Look at B and then tell me what he has. And what you know, use it to answer the question. Once again, if you go and take the board and you see this type of question, the next generation, they give you 6 cases and they never ask you what is the problem or they keep on mixing it, stand your ground and look for those things like, okay, we're talking about what? What patient we talking about? Client B, right? So, and I said, this is client B. He's 35-year-old. He has positive blood culture with MRSA, with a temperature of what? 100.5, right? His Y count is 20,000. He's receiving vancomycin. What do you think he has? How would you treat this patient? How would you take care of it? Which action by the nurse is a priority? But at least you know what is going on with this patient, right? He has bacteremia with MRSA, his temperature is that, his Y count 20,000, and he's getting vancomycin. So, what do you want to do? Which of this is a priority? Do you want to repeat the CBC? Do you want to infuse this vancomycin over what? At least 60 minutes, right? Do you want to assess for Cracos and jugular vein distension in this patient? Or you want to assess for facial flushing? Which is more important to you? Which is going to answer the question I'm asking you? Is a priority patient? Patient is getting vancomycin. He has infection with MRSA. What are you going to do? What is your priority? Repeat is CBC, it's white count with 20,000. Is getting vancomycin. You want to infuse the vancomycin over 60 minutes. You want to assess for lung crackles or JVD in this patient. And then you want to assess for what? Facial flushing. Whatever answer you choose, look at the patient. What do you think is wrong with them? 35. Bacteremia for MRSA, right? And his temperature is 101.5. It's white county 20,000. It's getting vancomycin. Which of these parameters worry you much? Worry you? Is it the blood that has MRSA? Is this his temperature that is 101.5? Is it his white count that is 20,000? Or him receiving vancomycin? If you know which one is disturbing you, then that's the one you want to focus on. Think about it. It's a prioritization question. Which one will you prioritize? That is all. You have to be sharp. That's what I call it. Repeating is CBC. He has infection. He has infection. It's not going to change anything. I know he has an infection. That's why he's getting antibiotic. Repeating is CBC. What are you going to do with it? It does not change anything. He will continue to receive his antibiotic. So it's not a problem. It's not a problem. The most dangerous thing about him is receiving vancomycin. It's a vesicant. Vancomycin is an antibiotic, it's a vesicant. It can cause necrosis of the skin. You can get extravasation, right? And if you infuse it too fast, you get red man syndrome. That is the most dangerous aspect of the whole thing. Yeah, red man syndrome, flushing in the face, you can become vesicant. It can even get anaphylactic shock from it. Vancomycin has nothing to do with lung crackles. You infuse it so slow that it's not going to cause lung problem. It's a very small volume. There is no evidence. Just because I put crackles and JVD doesn't mean it's because they are big words that is disturbing you. That means you fall for it. If you choose C, that means you're not answering the question that I'm asking you and you're not paying attention prioritization wise. There's nothing in that patient history telling you is getting too much fluid that is going to get JVD and lung crackles. So that's a trap right there. Of course, facial flushing. But before you get facial flushing, it's because of the rate. Therefore, if you infusing it too fast, that's what you get. Intervention in the order of priority, the nurse should implement for client D. Once again, very frustrating. The questions move from one patient to another. So, who is client D? Client D is a 25-year-old, type 1 diabetes, brought into the emergency room by the family with confusion. Did you get any buzzword there? Confusion, right? Type 1, that is your buzzword. Client is lethargy, is a buzzword, right? You check B sharp, lethargy is a neurological problem. It also shows airway problem, right? Abdominal pain, nausea. Who with type 1 diabetes has a lethargy, confusion, and abdominal pain? Then I give you rapid breathing, another buzzword, and vomiting. I have given you a diagnosis. Figure it out. I'm not going to tell you because the case is designed not to tell you, but you make it in the back of your head and said, oh, I know this. Dr. English showed me this. This is something, something. I know how to manage it. That's what you do. This is familiar. I know what it is. This is how I'm going to manage it. And that is what the question is asking you. What do you want to do? This is what we have. I'll range these questions in the order of preference, like how would the nurse treat the patient? So that was the question. First, we're going to make the patient NPO. So what next? What else are you going to do? We make the patient NPO. What is the next thing we're going to do? What are you going to do? Patient is MPO. We got to admit the patient to the ICU. What is your next step? You give the patient in D5W, you give them insulin, you give them glucose, replace the potassium, you check your finger stick. We know the problem. We've made the patient MPO. We admit the patient in the ICU. What is the next thing? Somebody said normal saline, excellent. Then what? We give the patient insulin. Now, after you giving the patient insulin, you got to check your finger stick. And then when your glucose get to 250, that's when you give them D5W before you replace their potassium. So this is the management of a patient. D, based on what they have. You know what they have. I'm not telling you what they have, but you figure it out what they have, and then you take care of it. Does that sound good? It's a bargain, right? Now, which finding the next you anticipate when assessing client C? Back again. Okay, we back again, right? Now, what does client C have? 4-year-old child with the forceful non-bilious emesis after every meal and a palpable abdominal mass. What do you think client C has? Okay, what does the client C have? I'm now trying to take you to a new content. You see, I'm trying to flip your brain, different patients, getting yourself all angle about content to be able to answer this question. You know what this patient have, 4-year-old. Then tell me what you're going to do. Tell me what you want to do. Do you check for dry mucous memory? Does the patient is going to have bradycardia? Does the patient going to have scaphoid abdomen? Is the patient going to have cardiogenic stool? Is the patient going to draw the knees to the chest? You know what I'm trying to get you to think, Brenna. He's going to have dehydration. You will have signs and symptoms of dehydration. Therefore, dry mucous memory, right there, right? If you have dehydration, you're not going to have bradycardia. So don't choose B. Just because bradycardia look it's worrisome, once again, just because an answer choice look worrisome, it may not answer the question being asked. That is the purpose of this case study. It look worrisome, but if you have dehydration, unless you're about to die before you become ready, you are like stage 4 shock. That's different. Refractory shock, no. In the beginning, this patient, I never told you is in shock. So it can be B, right? B is not a good thing. His abdomen will be flat, scaphoid abdomen. That's what we call it, flat abdomen, scaphoid. He's not going to have cardiogenic stool. Cardiogenic stool is another problem. And the person who has cardiogenic stool will be drawing the knees to the chest. So E is also wrong. So D and E are the same of something, a problem you should know. Carrying stool, drawing your knee to the chest is a specific problem. Once again, I'm not telling you the diagnosis because we make this case study easy. I want you to like look at it, and that is the way they would ask you. They won't tell you, and you have to go through. So D and E is another problem. Scaphoid abdomen and mucous memory is what we expect in this patient. If it's the same patient, now what are you going to do? He's been vomiting, forceful, non-bilious emesis every time he eats. And you make the diagnosis based on the signs and symptoms he's going to have. You have to make the diagnosis first. Then you figure out the signs and symptoms. That's why I asked you the first one. The second one, I said intervene, right? Intervene as much as possible. So what are you going to do? Plan of care. What are you going to put in this plan of care? Of course, the kid is been vomiting, so you got to be MPO, right? Now, it's not megacolon. This is not megacolon. There's no way this is megacolon. So he has non-bilious emesis, so he can be megacolon. No way. So he's MPO. What are you going to do next? It's a GI problem. Every GI problem, there's a common things you do. Everybody get what? NPO, IV fluid, pain management, antiemetic. And the rest is based on the condition, right? So if you're NPO, you get IV fluid, right? Based on the diagnosis of the patient, you need an ultrasound, abdominal ultrasound. If you know the diagnosis, then you know that it's true, right? Hey, he's been vomiting. Anybody who vomits, we got to get the electrolyte. Make sure electrolyte is not screwed up, right? Right? So that's the thing. So now, do you put an NG tube in this patient? No, it does not need the NG tube because it's not going to help him right now. It's not going to because there's the blockage. He vomits when he eats, so when he doesn't eat, he's not going to vomit. It's not like there's obstruction coming from below the pylorus. The obstruction is right at the pylorus. So if he eats, he will vomit. But if he doesn't eat, he's not going to vomit. If he just had surgery, what is the next priority? After hip arthroplasty and you are on the floor, what do you think? Number one, if you ask yourself, what number one thing the nurse should do to prevent the two legs from coming together? That's the priority. So you get an abductor wedge. Long crackles is not going to help him at this time. You expect his lung to have athleticism. You expect him to have low grade fever, 101.5, right? So, or though, the first 24 hours, it does not matter. I expect that. I expect him to have pain. I don't expect his bowel sounds to be great. All of them is something that I know is going to happen. So, the most important is that client A is ready for discharge. Now, you want to go home, the same patient. What is your priority? What teaching do you provide? Green leafy vegetables. You need a lab work when you're doing injectable anticoagulation, or you need to go home with a wheelchair. So somebody's A, say A. So I'm picking A, raised toilet seats, right? That's what some people say. Which other answers do you think is good? Somebody said B, don't cross your leg, right? Injectable anticoagulation. What are those? What are injectable anticoagulation? This was set to trap you. So what is an injectable anticoagulation? Give me an example. There's different kind of anticoagulation. What is an injectable anticoagulation? Coagulation that is injectable. Give me a name for it. Give me a name. Enoxaparin, right? Enoxaparin. Another one, I call them the Zabans, the Gatrans, right? Gatran or Zaban, Rovirozoban, right? These injectables, you don't need what? To change your diet. And another one is injectable and heparin. These are all heparin and base. You don't need, at the same time, you don't need lab work for these injectable when you go home, right? You don't need to do anything. That's a trap. Those ones, you don't need anything. And then the last one, we think is the right answer. You need a wheelchair to go home. The key is when you have hip arthroplasty, if you're not walking, you're not going home. If you're not taking a step, you're not going home. So patient has to be walking before they leave the hospital. So you don't go home with a wheelchair. So this is 6 hours. 6 hours after surgery, right? What do you see? What should worry you? What do you think is going on with the patient? His vitals, heart rate 110, his blood pressure 80/70, his hemoglobin is 7, his hematocrit is 28, his creatinine is 1.7, his potassium is 4.2. There's an order there, transfuse 2 units, PRBC stat. So if you got to transfuse this patient who is bleeding, what do you do? Right? So I see E, verify the blood with 2 licensed providers. Okay. What else you guys say? I see E here. So you're going to use Y tubing, right? So what about number one? What do you guys think? Set the infusion pump to deliver the blood over 2 hours. So A is right. One blood packed red blood cell, 2 hours is enough. Start blood, usually you can transfuse it over an hour. You can go, it's between 1.5 to 2 hours. You can go up to 4 hours, but you should not go past 4 hours. So blood transfusion, you can use one pack 2 hours, right? One can go to 2 hours. The maximum it should go is 4 hours. The minimum it should be 1.5, but it should not pass 4 hours. So this is right. Delegate viral check to the UAP the first 15 minutes of the transfusion, right? Um, so to B, somebody said no, you can't do that. The first 15 minutes of transfusion, the nurse should be doing vitals. So B is wrong. So B is wrong. How about C? Prime the white tube with 5% dextrose in water. So you're supposed to prime it with normal saline. So C is wrong. D is, I say, employ. You have to use white tubing for the transfusion. You verify with 2 licensed provider, and you have to spike the blood, okay, and dispose it per protocol. So that's what we need to do. Like I said, fundamental. Next is week. Let's go back to the foundation of medicine. You got to get it, and you guys know that, right? So set the infusion pump minimum 1.5 hours, maximum over 4 hours. Delegation first 50 minutes is wrong. The next does that. You use white tubing, but you prime it with normal saline, right? You got to verify with the 2 licensed provider, spike the blood product, and dispose the blood bag per protocol. Okay. Spiking means get the blood. You don't wait until the patient is there, and then you put the IV and you just connect the tube into um, the IV. What will happen is air will go into the tubing. So that's why you prime it and you set the blood. So you already run the blood from the bag all the way to the tube. So as soon as you connect it, it's going to the patient blood vein. So that is mean by spiking it. Spiking means so if this is I don't know if I can draw it. If this is the IV tubing and this is the line and this is the patient arm, you want to make sure the blood is all the way here in the tubing, waiting to be connected to the patient. So that is mean by spiking it. So spike it. You got to spike it. And the last one, client B. It's a 35-year-old client with a positive blood culture with MRSA, right? Um, MRSA with a temperature of 101.5 and a white count of 20,000 receiving vancomycin. Yeah, we verify blood with other RN. Yeah, any healthcare provider. License, the word license provider is what it means. So you know this patient, you know what he have. We just verifying it. He has blood culture for MRSA. He's getting his white count 20,000 and he has vancomycin going. So what intervention the nurse should implement when caring for the patient. If you're caring for this patient who has MRSA bacteremia, you're getting vancomycin, what do you do? Somebody said single equipment use. So what says you? Somebody say E, Next down, gown, gloves, face shield, goggles, masks for dressing change. What says you now? Somebody says, see, next down, gown, gloves for routine care. So if you don't know, you only know one, I want you to pick one. If you know two, I want you to pick two. If you know three, I want you to pick three. If you think there's four answers, I want you to pick all of them. But whatever you know, just pick them. But do not over-select, because if you over-select, you're losing point. If you know only two, pick it. If you know only one, just pick it. This is a contact precaution. All you need is a single-use equipment. In contact, what you need is gown and gloves. That's the PPE you use. If you change your dressing and there's a risk for splashing in your face, you got to cover your face. If you have mask, you put on. If you have goggles, if you have a face shield. But the rare thing for contact precaution is gown and gloves. But when you change your wound, you got to add other PPE. So E is right. And so this is the end of the case. And I hope you guys enjoy. These are the patients we saw. You know what each one of them have, and you figure out what to do with them. This is adaptant class. If you need more resources, you can join our membership. Our membership, we have 3 levels, is on YouTube. You can just click on the join button and you can watch a bunch of videos